Let's bring in Dr. Nicholas Reed from the Cochlear Center for Hearing and Public Health. He's also an assistant professor at Johns Hopkins Bloomberg School of Public Health. Doctor, good to see you. Thank you for joining us.
Thank you for having me.
Of course. The FDA expects this move will save about $1,400 per hearing aid and $2,800 for a pair. Help us understand how big of an impact this will truly make for those who wear hearing aids.
I think this is a huge impact. I think on an individual level, this is a chance to rethink hearing care in the United States. Right now, it's a model where you're either on one side of the fence or the other. You're all in or you're all out. And now we have a different entry-level model, if you will, to get you into the OTC before you may need prescription hearing aids later on. From a cost standpoint, as you mentioned, this is a huge cost savings. The average cost of hearing aids in the United States is $4,700. And that comes with a lot of time and effort. Many visits with an audiologist, as you can imagine, for someone living near federal poverty level, that's not easy to do. It's not easy to take time off of work and go see somebody over and over again. And so these devices are designed to be self-fitting, more convenient, readily accessible, and more affordable.
These hearing aids will be available to those over the age of 18. Is it common, doctor, for younger age people to need hearing aids, and how would you even know if you need them?
That's a really good question. So hearing loss in the United States and in the world is related to age. Relatively rare among children and adolescents. The current incidence is somewhere between 1 in every 1,000 and 3,000 births. And most of congenital hearing loss is often what we might call either severe or profound hearing loss. Whereas age-related hearing loss usually sets in over time and sort of gradually declines. You have more of these mild and moderate hearing losses. And with age, hearing loss becomes very common. Once we get over the age of 60, half of all adults have a clinically meaningful hearing loss. Once we get over the age of 70, it's 2/3 of all adults have a clinically meaningful hearing loss. So common among that group. How do you know you have hearing loss? Oftentimes it really is difficult to notice because it is so gradual and it sets in so insidiously slow. We might say things like, why are other people mumbling? And that's because hearing loss is a clarity issue, not a volume issue.
That's a good information there, and it's good to know for people to look out for it. Doctor, we follow you on Twitter, and we urge others to do the same. You tweeted earlier today when you addressed the use of over-the-counter hearing aids, and you wrote that the U.S. has been using a distribution model for a device that no longer exists. What do you mean by this?
Yeah, that's threw me off with my tweets. What I mean by that is, the current model of hearing care in the United States is really born out of the 1960s and 1970s, when hearing aids were these analog devices that were useless in the hands of a layperson, in the hands of the public. You really had to be an expert to use it, and they truly were dangerous. They could get extremely loud and cause damage to your hearing. But since the mid-2000s, hearing aids have really become just purely digital. We've had a digital revolution, and they can integrate with smartphones. They have processors that can, manipulate sound. You can actually use the smartphone to program the hearing aid yourself. It's a really different device, and yet the distribution model hasn't caught up with that. We're still living in an era where the professional is a gatekeeper, essentially, to the device. And perhaps, as we're seeing now, we're starting to catch up where individuals may be able to leverage the smarter technology that we have to go ahead and fit their hearing aids themselves.
Yeah. The FDA estimates 30 million Americans experience hearing loss, but only 1/5 of them get help. So we're expecting a lot more to get that help now with this new FDA ruling. Dr. Nicholas Reed from the Cochlear Center for Hearing and Public Health, I appreciate the time. Thank you, sir.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.